Welcome to AGD 2021, the premier meeting for general dentistry. Facebook Live is sponsored by Colgate. Welcome back to the premier meeting in general dentistry, AGD 2021. I'm Rachel Kopchak. Students, residents, and recent graduates all receive free access to the event, as well as free lectures and exclusive access to the new Dentist Lounge, which is where I am right now. Now, this is the place where incredible networking opportunities are offered, as well as education. And I'm here now with Dr. Miley Duong, who is one of the presenters and also one of the coordinators of this incredible lounge area that you have put on such incredible events for the new students. So we will start with, what are you presenting here today and what can people expect to learn?
Yeah, of course. So first of all, hello everyone. Thank you so much for joining us. So today I have the privilege of partnering up with Dentist Advantage, which is a malpractice insurance company. They're not only sponsors of our lounge, but they are a corporate sponsor for the AGD as well. And so they provide malpractice insurance support, but as well as some discounts for our students and new dentists as well. But today, Jennifer Flynn is going to be talking about malpractice and how to reduce your malpractice risk. And we're actually focusing on root canal therapy and how to reduce the risk of getting sued for root canal therapy issues. So she'll be presenting the malpractice side, and then I'll be presenting on tips for the clinician to reduce, like tips and tricks in the clinical side so that you can reduce your risk for getting root canal therapy issues.
Yes. And what would you say would be your best piece of advice for new dentists coming into the field and in regards to what you're presenting today?
In regards to the area that I'm presenting on, which is endodontics or root canal therapy, I would say that it is so very, very crucial to make sure that you know what your skill level is in regards to root canal therapy. If you know your limitations, because if you don't know your limitations or you move past your limitations, you could be putting yourself in a lot of great risk for yourself, but not just for yourself, but for your patients, right? We all want to provide quality care for our patients. So know your limitations and then be able to refer out when you aren't sure what's going on.
That's a great piece of advice, Dr. Duong. Now tell me, how long have you been a member of AGD?
I have been a member of the AGD since I was a student. That must have been around, like, I was a third year student when I joined, so 2010-ish, so that's what, 11 years? Yep. One of the reasons why I joined AGD is I recognize as a student and a new professional, I really wanted to align myself with an organization that I could depend on, that I could lean on, that I could trust. I could reach out to different people and be able to find mentors, and that's exactly what I've been able to do the last 11 years, and I plan to continue looking for mentors and leaning on the AGD for help, but I'm also looking forward to giving back to the students and the residents and the new recent grads.
And what would you say to those recent grads and other dentists who aren't here? What are they missing out on?
Oh my goodness. So, you can get CE from a lot of different places, but I think what makes AGD the most special is we really are, and we're not just mentors, we're like a family. It's like a family reunion every time I go to an AGD event, whether it's House of Delegates or the scientific session or any CE course that the AGD puts on. People genuinely want to be here. They remember who you are. They really just care, and I think that's what makes it so special.
Yes, it is a special event, and thank you so much for taking some time to chat with us. We'll let you get prepared for your side of the presentation. Thank you so much, Dr. Duong. Appreciate it. Now let's take a live look into what is being presented right now.
And where you draw the line when you refer. And so I know that in my hands, I usually will work up to a 40, and most of the time based on my preclinical evaluation on my x-rays, maybe even a CBCT if I have access to it, I can already know if I don't have the instrumentation or the armamentarium to perform that root canal, and then I refer out. Make sure you have an electronic apex locator. It is so very important. It is one of the most important instruments or machinery that you can have to help you do your job the best that you can. And then make sure you truly understand your rotary shaping files as well as your obturation system. Now, sometimes there's going to be a lot of rotary files that are, they are sold with an obturation system, so that the transition from the rotary files, it makes it like really easy to know what your GP cone is going to be. Like when I first started out, I used Gutacor, and when I talked with my Tulsa rep, it was a very easy transition from using the protein profiles to the Gutacor system. But you never know where you're going to end up if you don't own your own practice. You might be working in a community clinic, you might be working in a private office, a corporate office, many different types of offices. And you can't always have that sister systems, right? Those sister systems.
Now, that is just a sneak peek at some of the courses and lectures that are being offered to new dentists and recent graduates that are in this field. We will be back in just a little bit with some more live coverage of AGD 2021 for you. You're watching AGD Facebook Live, which is brought to you by Colgate.